SoundCloud. Great. Well, hello everybody. I'm Jenny Kilpala. I'm the Communications Coordinator at the Peter White Public Library. Today we're having a community conversation with Dr. Debra Smith. And Dr. Smith, you're here today to talk with us about mental health. Is that right?
That's correct. That's correct.
And can you tell us your background so that we kind of have an idea of where you're coming from?
Sure, I'd be glad to do that, Jenny. I'm actually a licensed psychologist. I've been practicing for the last 30 years as a clinical psychologist in the community. And then I have kind of a second career, and I'm also a mindfulness meditation teacher in the community. So I've been doing that for the last 5 years.
Great, thank you.
Yeah.
So today we want to talk about mental health, which is a hot topic and on everyone's minds right now as we're dealing with coronavirus. But it's also Mental Health Awareness Month in May. And so the library does do a lot of mental health programs traditionally in May. Here we are. And so let's start out with, everybody is handling this differently because everyone's life story is different and where they are up until this point. And knowing that, how can a pandemic like this affect individuals, the community? Can you give us some information on that?
I sure can, Jenny, and it's a great question. And whenever we're faced with events in our life that are challenging, difficult, unexpected, we typically have kind of two choices in ways of responding, either as individuals or as communities. One way is opening, and the second way is constricting. And when I talk about opening, we're talking about kind of learning to open to actually life is very uncertain, and it always is. It's not just pandemic, but it's a number of things, and we can be open and kind of accepting of that uncertainty. We can open ourselves to what these kinds of experiences are teaching us. We can especially open ourselves in our communities to more compassion, more kindness, more generosity for others. And we've seen that so demonstrated with Mass for Marquette and the generous outpouring of donations and the collection of food. And, there's just so many ways that this is happening, even the community responding with going outside and wave to your neighbors at 6:30, there's this opening to those kinds of experiences. We might even find ourselves opening to more creativity and even more closeness. I've heard so many stories about people reaching out to people they haven't talked to in a long time. So there's this ability to open. There's also this reaction of constricting, and that's kind of our second choice, and that's pulling away from what's going on around us, becoming more and more fearful, just closing in, becoming more anxious, more isolative, less interactive. And we can become more consumed by news, especially the bad news, which tends to increase our fear and anxiety. And we can really tune ourselves and constrict ourselves to just paying attention to bad news, bad events, bad feelings, and really lock into that part of it and lose the balanced view that both are happening. And so we kind of, based on our personalities, our habits, pick one or the other way of responding to challenges, whether it's pandemic or the loss or illness of a loved one or a divorce or an accident. We tend to have these same reactions, choices.
Okay. Okay, and so would you say, so it sounds like maybe it's one or the other, then would that that reaction be more magnified in a situation like this?
Yes, because the longer it goes on without relief and without shift, and the more likely we are to kind of hone in on one or the other, and it gets really, really exaggerated.
Okay.
Yeah.
So do you have any tips you can share with us on how to strengthen our mental health right now?
I sure do. I actually have a prescription pad that I use. Even though I don't write prescriptions, I like to let people know that there are very specific things that can help us every day, whether we're in pandemic or not, since we have a foot both in pandemic but also in mental health. One of the very first things that I recommend is that we actually acknowledge that we're in the middle of difficult times. So often we kind of say, we kind of push it down or push it away. And it's very helpful to just say, you know what, this is tough, this is hard, this is difficult, no matter what the challenge is that we're facing. And then acknowledging and labeling our feelings and our emotions and being able to say, and in this really tough time, I'm afraid and I'm nervous and I'm, anxious about what's going on, and I might be sad or depressed, or I might be feeling really joyous and compassionate when I hear good news, but just being able to say, this is what's going on inside of me. Finding something to be grateful for, we know is really critical. And, you can go to the Good Science Center at UC Berkeley, and they have tremendous things for how to build our resilience. And doing a gratitude journal is one of them. It's a very, very helpful and very strong medicine. Finding a direction for our energy. We generate a lot of energy when we face challenging times. It's a kind of a neurobiological response, but we have to have somewhere for that to go. Okay, so exercise is really, really critical and important during these kind of times. Getting outside in nature, research shows that even 15 minutes in nature can calm our responses and help us cope better to all kinds of things. Connecting with others is real critical, not being isolating, but reaching out. Giving and generosity is very important. Helping others is a good counter to our own distress. Limiting news, or at least balancing news from good news, and making sure that we have as much good news coming in as bad news, so that we know that this isn't a total catastrophe and we're not tricking ourselves into a catastrophe, that there's actually good stuff going on in the world, and we need to keep that balance. And then finally, balance is always important no matter what we're doing. So a balance between quiet time and alone time, where we can just let our system settle a little bit. Productive time, where we're feeling useful and we're putting out something important. Connecting time with others. Exercise, as I mentioned, but being able to balance and kind of devote equal attention to all of these things can really help our mental health across the board.
Can you tell me how, right now at the library, we're having discussions about what services are going to look like. And the question we keep coming back to is, but how can we plan, because we don't know dates. We don't know, what community spread will look like. There's just all this unknown. So what does fear of the unknown do for our mental health?
Well, fear of the unknown, fear in general, really triggers us into fight or flight. It turns on our primitive brain, and it says that there's danger. And our brains interpret that as if we were facing lions, tigers, bears, or poisonous snakes. And then it builds our body to react to that. So it gears us up to either run from that danger, that actual physical danger, or fight it if we have to, or in some cases we freeze and kind of play dead. So fear triggers this in us, and it's really critical to remember that there really aren't lions, tigers, bears, or poison snakes. So no matter what we're facing, they're just simply problems to be solved and challenges to deal with. Planning is like, there are some generic things for that, and saying, when we get the go ahead, here's our step off, and modify that as we go. Locking things in isn't possible right now, and so we have to have a lot of flexibility. And we can only have flexibility if we manage our fear.
And how can that look? What does that look like if you're in a fight or flight mode as a person and there's no bear or snake?
Lions are.
Right. What does that look like then if you don't recognize that? What can that look like for the person who's experiencing that?
First of all, it's incredibly uncomfortable because our body is ready to put out a lot of incredible energy. So I liken being in that state to sitting in a car that's running. It's in park. My foot is on the gas, and the gas is all the way to the floor.
Mm-hmm.
You can imagine that sense of the engine whining, and eventually parts start flying. So our jobs, no matter what we're facing, our jobs are to figure out how to get the foot off the gas, eventually get the car into park to discharge some of that energy, or to shut the car down in the first place by calming the system. And only then can we actually kind of bring our heads on board so that we can do problem solving and good problem solving and figure out how to be flexible with what we're faced with. So Rick Hansen talks about, and he's a great neuroscientist, talks about this is our primitive brain, this little bit right here, it's our brain stem. It's the part that's responsible for fight or flight and keeping us safe, survival. And then this is our prefrontal cortex. That's our thinking, our problem solving, our ability to see the larger picture, our ability to stay calm when faced with things that are challenging. At times like this, we do this. And we lose that whole ability to think and plan and see big picture and do good creative problem solving. So our job is to bring this back on board.
Yeah.
Does that make sense?
Yeah, and it certainly, this doesn't look very this doesn't look sustainable. I feel like that would be exhausting.
It is exhausting and it wears us out. And if we don't discharge that energy, then we find that we're coping with the symptoms by drinking, overeating, using drugs, overworking, shutting down and checking out, not, becoming more fearful and more isolated, that constricting again that we talked about. And eventually it will wear us out and it will compromise our immune system and it will make us more vulnerable to illness and long-term chronic conditions. We start not sleeping well or sleeping out too much and it just wears us out. Yeah, exactly.
So you've talked a little bit about kind of what that anxiety does to our brains. Shifting a tiny bit, if you pivot, a lot of us are using technology right now for work or just because we're trying to connect with people. And so we're getting a lot of messages and by way of looking at the technology so much. So in a lot of instances, there's a lot of, and I hate to put them all in a box as a generalized negative message, but something that just isn't uplifting or that's hard to read. And so what is that doing to our brains coupled with this anxiety that we have or whatever's going on with where we are?
Well, that's a great question, Jenny, because, our brains are already, because of evolution and that little survival brain that I talked about, we're already geared to always pick up the negative. We call it the negativity bias. And we're geared to do that automatically, to scan our environment for negative and see it and find it. We are not geared and we're not at a stage in our evolution where we pick up the good as easily. So knowing that we're always going to be kind of more prone and vulnerable to negative messages, then we have to use that prefrontal cortex to manage how much we expose ourselves. And I talk to people all the time about limit your contact with news. Okay, limit your contact. Set up 10, 15 minutes. I'll scour for anything important, and then I just need to shut it off. And then counter with going after the good and finding what is good that is happening. What we know is it takes about 10 good messages to undo one negative. So we have to be very vigilant about seeking out good news or good websites or good messages or places where good things are happening. And we have to be very vigilant about that. And when we do that, it really kind of takes us out of that fight or flight and puts us in that rest and digest mode where we can kind of get balanced again and let our brains and bodies relax a little bit. So it moves us out of constriction and into opening. Does that answer your question?
Yeah, yeah, I
Yeah.
think it does. Yeah,
Okay.
interesting. I hadn't known about that negativity bias.
Yeah.
I just know there's a saturation of information, it seems like right now.
There is, and it's helpful, I think, for us to think about what's the most important thing for me to know.
Mhm.
And then that becomes my focus. The most important thing for me to know is how to protect myself, how to protect others, and how to take care of my basic needs. So where am I going to find that information? And then those are the sources that I go to, and I pick reliable sources for that. And the rest of it is extraneous. To a huge degree, we are in survival mode, and we can narrow that right down to making sure we're taking care of just our basics.
And you mentioned that you also are practicing meditation, or you lead meditation groups right now.
Yes.
And we did a meditation workshop as a whole staff at the library back in November. And so part of that exercise was just making yourself aware of that feeling. So how are these things affecting me? Could you talk a little bit about that? You could probably do it better justice than I can. Just understanding, like, how, am I feeling this right now? And you did talk about that in your prescription earlier too, but do you want to expound on that?
Sure. Another love near and dear my heart is mindfulness meditation. And for a couple of different reasons. One is because it's been shown by research in neuroscience to really kind of slow down and shut down that fight or flight system, what we call the arousal system, and has a better job of taking us into rest and digest, again, where we can access more problem solving and, much better skills. Meditation is the practice of becoming more mindful, more aware in our lives, and becoming more accepting, not approving, but accepting of the experiences that we're going through. So it has a way of reminding us that life is uncertain no matter what. This is just one form of uncertainty, that we will always be faced with uncertainty. And by being able to practice meditation, you're observing these experiences and what's going on. As I mentioned, what am I feeling? Kind of what am I thinking? Am I in kind of a catastrophic thinking mode? It takes us out of our catastrophic stories about how awful everything is going to be, and brings us back to a moment where maybe things aren't so catastrophic. Maybe they aren't so bad right now. Maybe I'm enjoying time with my family, or talking to my friends, or being creative, or doing something I didn't get a chance to do before. So it gives us a chance to really come into more balance with everything that's going on.
Okay. Let's see, a couple other questions that I had. You mentioned that we have, when we question what we need as far as information, one of those things was, how do I get my basic needs met? Mm-hmm. And I feel like, being that I'm at home and social distancing from people, I have a perception right now that stress facing other friends as I'm talking to them, relating to a potential illness, financial stability, getting basic needs met. It's just, those stresses seem to just be huge right now for a lot of people. So how is it possible for them? It just seems like so much, like an unbearable load. How are they able to deal with those things? Because it seems kind of like a bunch of crises all piled on top of each other.
Right. And it is like that. I mean, that's reality right now for so many, not for all of us, but for so many, that there are so many critical components going on, that it does get to be about survival at some level. And I think, again, we have to start with acknowledging that this is tough. This is really tough. This is really tough for, huge segments of the population, and for individuals at all kinds of levels. And just being able to say this is tough. And then, you know, bringing some self-compassion to this, I think, is also really critical. And that's not a selfish maneuver. That's just being able to bring the same kind of kindness we give others to ourselves. Okay. And being able to say, yes, this is tough. And there are a whole lot of people in this with me. I'm not alone, right? There are a whole lot of people that are facing these very same crises. And then shifting in just a little bit of good news. And there are a whole lot of people who are trying to help us with this, right? You know, there are all kinds of systems that are aware of this and are trying to help with this and remembering to do that. And then bringing a nurturing piece of behavior in. What do I need to do to just be kind to myself when this is so bad? You know, when this is so difficult? And it might just simply be, oh, you know, hand on the heart. This hurts. This is tough. Everybody's going through it. And everybody has these same kind of reactions. And then what can I do to just manage myself right now? And then when we approach those crises, we have to remember that we can only really handle one at a time, one thing at a time. That when we walk into a room packed full of stuff, we aren't going to empty it with a snap. We have to deal with it one box at a time, one drawer at a time, one section of the room at a time. And if we can just do small bites at solving those problems, maybe spreading it out over a few days, you know, we can continue to work at kind of keeping our balance, you know, a little better. Is that helpful?
Yeah, so if we are, as a community, looking at how to help people with those basic needs or some of the things that we're talking about, the good news that we're hearing about, but moving forward, it's evolving because people's needs are evolving, or we're hearing more about them. So how can we as a community kind of meet them then where they are mentally, or not quite sure how to ask the question, like what kind of support system do we need for this on a big level for everybody?
Oh boy, we need a big support system within our own homes. We need a big support system on our blocks, in our cities and towns, and globally. We really need huge, gigantic support systems. We have to kind of think again about, am I constricting, or am I opening it? We need to open to each other. We need to do that with a compassion, kindness, and generosity. So we have to find places to give. And this is one of the top things about countering depression and anxiety is helping somebody out. And so we have to really look for those places. Can I sew masks? You know, can I give money to room at the inn? Can I check on my neighbors by simply making a phone call or walking by their house while I'm out for my daily exercise and seeing if anything's different? You know, what are the things that I can do that supports everyone else who's in this situation? And then, you know, every little bit that we do individually has a ripple and a global effect. And we have to remember that, and we have to see that, and go looking for it and know that it's actually happening.
Now, as a clinician, you know, we've talked a lot about tips that everybody can use that will benefit everyone. But I was reading today, because it is Mental Health Month in May, that the National Mental Health Alliance, well, it wasn't NAMI's website, but that 1 in 5 people struggle with mental illness at some point in their lifetime.
Yes.
And so knowing that, then you have people who going into this knew that they were, as you put, you know, going into the room, working through things. Where are they at? What kinds of resources do they need right now? Is it different than what you told me?
Well, I think one of the things that we have to do is we have to reach out for those mental health practitioners that are available. When our mental health was already kind of, you know, shredding under just normal everyday things, it's going to really kind of collapse at times like this. So knowing where those resources are, the state has a national mental health or a mental health resource line you can reach out to and talk to somebody. You can call dial help. You can call your local community mental health. Therapists are now eligible to provide telehealth online and by phone therapy and get paid for it. We weren't able to do that prior to this pandemic, but now we can. So the therapists are available. Reach out to, whoever is on the list. Hook into online support groups that might be available. I know they have AA groups and all kinds of groups that are available to hook into and make sure that it's one that has you feeling better at the end, not worse. And really reaching out for those resources. Many of the trusted websites have lots of material available and links available. The CDC itself does for how to reach out for mental health services. The American Psychological Association does. The National Institute of Mental Health has connections to resources. Johns Hopkins, Mayo, all of the major medical units have connections to resources. Reach out and use them.
Okay. Yeah, thank you. I was going to ask you for some of those later, so that's great. And we'll go ahead and include that list. We'll put a link for people that they can get all of that.
Excellent.
With this interview.
Yeah.
So the last one I have before my final question is, there's a lot of families who use library services, and maybe it's not just families. That's just the group that came to my mind because I can personally relate. You're trying to work from home with children while they're doing remote education. And now all the meals mostly are happening at your house because you're not going out for that reprieve. Your social connections are now all virtual, and that's just a lot. It seems like, you've just taken on a bunch of full-time jobs. So can you just speak to how much that puts on families' plates right now? Because we've seen all the funny memes of kids Zoom bombing meetings and, even news reporters and just everybody is going through it. You see it everywhere.
Right. Part of what I would suggest, though, Jenny, is that the activities that we're engaged in and the things that we're doing probably don't expend as much any more energy than what we did before. It's just that it's so different. Okay. So if you stop and think about, the kids are home and we're doing homeschool, but before I was running them to school and I was running over to take their cupcakes and I was running over to attend this and I was running over to do that and I had to squeeze that in among this schedule while I was doing this meeting. And when we kind of take a look, it's a different activity, but it's not, I think, more or less. We were stressed before, it just looked different. So some of the same things apply here that apply in our normal daily lives. We have to keep a keen awareness of structure, and routine. And that helps us all when we can add predictability to an unpredictable situation. So that's helpful. Remembering to keep balance. I can't sit in 8 hours of Zoom meetings without a break. I need to get up. I need to move around. I need to say no. Just like we can't do that sitting 8 hours in a room. We just don't do that well. So we have to remember that we didn't do that anyway. Right. So we shouldn't expect we can do it now. And keeping that balance that I talked about before about literally scheduling in quiet time, a time for everybody to get quiet. If there are multiple people in the house, setting up a quiet room, or a quiet space where when somebody needs it, they can go and they can just be, and they know that they're not going to get interrupted, that's a sanctuary for anybody who needs it, and that we all take advantage of it, right? And that we even evaluate for what's essential. And we don't do a very good job of this when we're not in pandemic. Right? We don't do a good job of evaluating, are all of these things on my list really that equally important? number one. And number two, do they have to be to this level of standard? Right? So keeping in mind that we're prone to being extremist, we might want to work at coming back to the middle ground. Yes, I'm cooking. Does it have to, doing more meals at home? Does it always have to be home fresh cooked? Right? Or does a sandwich work? Or, and modify our expectations.
Yeah, it's an interesting balance that I can see. Yeah, maybe I could serve cereal for dinner.
Yes, maybe I could serve today. I could serve cereal for dinner, or we're all going to pitch in, and you got to make your own sandwich because I don't have time to make. I mean, we have to modify those things, and
Sure.
what we really want to be able to do. I'm teaching a course on resilience right now. What we really want to do in any part of life is to expand our ability to be flexible and elastic.
Yeah.
Right? That's how we're going to respond to all of this, whether it's planning for our return or, coping with what's going on right now or what life used to be. The more kind of flexible and elastic we can be with expectations and standards and our ability to evaluate what's essential, the better we're going to do.
I did forget to ask one question I don't want to forget. So we're going to come out of our homes. We're going to transition to whatever that's going to look like, probably socially distanced, but we're going to go back to work for a lot of us in settings where we're with our coworkers again, and maybe we're dining out and going downtown to shop or whatever that looks like. How can we mentally prepare ourselves for that? Like, what can we expect for our own mental health going into that transition?
Yeah, I really love that question. And, I puzzle about that myself. And remembering that we can approach that either by opening or by constricting, that we can take the same kind of fearfulness that we might have in this time out there in the world, or we can become overindulgent and overexpansive and maybe overdo things, and recognizing what makes the most sense for us, what feels comfortable for us and meets our needs. And that might be having to continue some protection, wearing a mask, keeping a little bit of distance for a while until we feel safer, because we really have to attend to our safety, our sense of safety first. So really thinking about what is it going to be for me to feel safe, and recognizing there's going to be people in my environment who may not even give that a thought and may just be out there with everything. We've seen that during, the shutdown, that there's just no sense of risk, and that we might have.
Can you speak to that? Because I think for a lot of people that feels personal. Like, you're doing this because you're not considering me, but is that actually what's going on?
No, what we're seeing at work here is a defense mechanism. This is just how some people react with fear, terror, limiting, or uncertainty, is to go to an extreme. And, we can always go to an extreme, whether that's I'm not leaving my house for the next 3 years, or it's, there's no danger and everything's safe and I'm going to do what I want to do. We can react in extremes. And it's remembering that there are people who will fall in that category, and that we have to be able to set a limit if that's where we're coming from, and say, keep your distance.
Yeah.
You may not believe it. It may not be important to you. It's important to me. Respect my wishes. So we have to be really tuned into where we fall on that continuum, right? And then what we need to navigate as we get back into this world and this life, to keep a sense of safety, well-being, okayness.
My final question today is one we've been asking all of the people we've been talking with, and that's how Peter White Public Library can help recover, how we can help the community heal after we've been isolated and as we're going into a period of uncertainty still.
I think Peter White Public Library is doing some amazing things. My hats are off to you folks with all that you're doing. I think posting the resources is really critical. I think these kinds of sessions are critical, and continuing them would be really, really helpful. Maybe taking a look at some ways to open to, more publicly available programming like you've been doing to just help people kind of process and talk about some of this and manage some of the discomfort that goes with it might be helpful. Maybe focus groups or sessions.
Sure.
Yeah.
Great. Well, thank you so much, Dr. Smith. It's been a very knowledgeable day.
Well, thank you. I hope I didn't throw too much at everybody. There's a lot, but
yeah, and like I said, we can put resource links about all the things we've been talking about attached with this interview, so that as people want to look into some of the things you covered, that they can go do that.
Wonderful, wonderful. Well, it was a great experience. Thank you.
Yeah, well, thank you.
Okay.